So hi everyone. So today I am going to show you people about lungs. So it is very important organ. So you could have read once theory, then you could have revise with my class. It should be quite easy. So here this should be the anatomical position of the lungs. So you can see this. So here it should be the anatomical position of the lungs. So here what you can see the space. So here you can see the heart with the pericardium. It has to be covering over here. So this we can go through with the detail. So there is a right lung and this should be the left lung. Okay. So compared to size and the width, so left will be quite smaller compared to the right. Okay. So this should be the right lung, this should be the left lung. And in some books says right lung has 3 lobes with 2 fissures and left lung has 1 fissure with 2 lobes. So I kindly request you people, so don't compare with the fissures and the lobes. So because sometimes we can see only 1 fissure in the right lung, same fissure, only 1 fissure we can see the left lung, and 2 lobes in the right lung and 2 lobes in the left lung. Okay. So here when you can see this part, so this should be the right lung, what I had said before. So there is only 1 fissure over here. So this should be the horizontal or the transverse fissure. This should be divided into 2 lobes. So there is no oblique fissure over here. So because of that, so some of the lungs it holds only with the 2 fissures, only with a single transverse fissure. It is not fissure, it should got cut. So while taking a section, so this should be the fissure, it should be separate nicely. This is not going to separate. So this should be the horizontal fissure. We can see only 1 fissure within the right lung and should be divided into 2 lobes. Okay. So next thing, when you can take whatever the lungs, so lung will be the respiratory organ, you may know that. So it will help for inspiration, expiration and exchange of gases. So everything through the pulmonary circulation and all. I am not going to detail with about that. So you know this part. And this lung characteristic feature, you may see whatever the lung, so this lung has elasticity, so it will helps to elastic, and it has expansion and recoil, and along with that it will be a spongy type. So you can see this should be the spongy pattern of the lung. And when you can see the newborn, so recently born, so this lung, when you can keep it within the water, it is not going to float, it should be go and settled in the inside the whatever the chamber. So because there is no formation of your alveoli and the lungs, because of that you may see the medico legal case, that should also will be clinical importance. So coming to the adults, it should be almost quite grayish in color. When you can see this lung, so this should be quite grayish because of the carbon particle has to be deposited. So when you can see the infants and adolescents, so there you may see the pinkish color, pinkish lungs. So but here I am holding now, it should be the adult and the cadaver. So this should be, you can see carbon particle, and it is goes to be grayish in color of the lungs. So we can divide it into 2 parts. So one I will show you about right lung first, so then I will show you about left lung. Okay. So next, coming to the right lung, so what I had said, this should be the anatomical position. Okay. When you can see the right lung, this should be the anatomical position. Here you may see the surfaces, borders and the impressions. Okay. So when you can see this, so there are the ribs marking you can make out here. So there are the ribs has to be compressed over here. So this ribs has to be compressed, that has to become laterally, anterolaterally. So this part we can call it as costal surface, because ribs has to be present over this. So we can call it as costal surface of the lung. Okay. So one has to become medially. So medial surface, you may see the structure. So these structures are entering and exit from the lungs. So these structures we can call it as hilum of the lung. So this lung of the hilum has to become medially, so towards your sternum. So we can call it as mediastinal surface. So this part will be the mediastinal surface, and here should be the costal surface because of the ribs impression. And one more surface, it is goes inferiorly. So this part we can call it as inferior surface or the base. Okay. So when you can hold this, so this will be the almost quite triangular in shape. This is the apex, has to becomes upper part, and it should be the base comes to the lower part along with the inferior surface. So when you can hold, it is almost half conical in shape of each lung. So when you can see both the lungs, it will be form conical shape. So that's what your thoracic cavity will be the conical shape, not the lungs. Lungs should be half conical in shape. So coming to the right lung, so same surfaces and the borders will be similar to your left lung. So one has to be apex at the upper portion, and coming to the base, so base over here, so this should be along with the inferior surface, and one I have said about costal surface anterolaterally with the ribs marking, and mediastinal surface, it should becomes medially towards your sternum. So this should be the mediastinal surface. Here you can see the mediastinal pleura. So mediastinal pleura again divided into at the root of the lung, so it is nothing but the hilum, and above the root of the lung and below the root of the lung. So those structure you had seen in my last previous video. So over here you may see the hilum. Okay. So next, so these surfaces will be divided by the borders. Okay. So when you can see anteriorly, so this border will be very sharp compared to the posterior border. So this should be the anterior border. It is sharp, comes anteriorly. So this is anatomical position. So here you can see the sharp border from your apex till your base. So this part we can call it as anterior border. Okay. That should be continuation with inferiorly. It is inferior border. So there is an inferior border, and coming posteriorly from apex to base, here you can see the rounded. It is not prominence, it is less prominence. Here you can see the posterior border. So this should be the posterior border. This is the posterior border, will be rounded, and this should be the anterior border, will be sharp, and this should be the inferior border. Okay. So this anterior border will be divides your costal surface anterolaterally, and medially will be the mediastinal surface, and inferior border will be divides costolateral surface along with inferior surface or the base, and posterior border over here, it should be the rounded. So this posterior border will be divides costal surface and the mediastinal surface. Okay. So this is the anatomical position. When you can see the anatomical position, it should be quite easy. You can see understood about impressions and everything. Okay. So coming to this part, here you may see the anterior border, posterior border, apex, base, and costal surfaces. So coming to the costal surface, so what are the ribs impression you can see? So this part just below the apex of the lung, you may see the first rib impression. So this should be the impression or impressed by the first rib, mainly the inner border of the rib. So this should be the first rib impression. That should be divided into apex and the remaining costal surface of the lungs. So from here, so there are three lines if you know about pleura. So here you may see the clavicle. So this should be the mid clavicular line. So here it will becomes to the axilla, mid axillary line, and posteriorly you may see the scapular line. So this should be the scapular line. This is axillary line. Over here you may see the clavicular, mid clavicular line. So from here, this should be ends at almost 8th rib level, sorry 6th level, 6th costal cartilage. It should be end anteriorly. This is the lung. I am not telling about pleura. So this should be ends at 6th costal cartilage. Over here you may see the 8th rib impressions over here. So and posteriorly you may see the 10th rib impression. So just beneath that you may see the costodiaphragmatic pleura. Leave it about that. In scapulary line you may see the T10 or the R10 or the rib 10, and mid axillary line will be the rib number 8, and anteriorly mid clavicular line you may see the 6th rib. Okay, there are two spaces will be present for your diaphragm along with costodiaphragmatic cases. Costal surface you may see the ribs impression, mid clavicular line, mid axillary line, and vertebral line. Okay, so that you may see the impressions in costal surface. So here you can see nicely with the ribs has to be impressed over here with your costal cartilage and intercostal spaces. So these are the intercostal spaces along with the ribs impressed over here. Next, so coming to the mediastinal surface. So this surface is most important. Be concentrate. So this mediastinal surface you may see the hilum of the lung. So hilum is nothing but whatever the foramen you can study it in your bones. So here also you can see the openings. So that openings we can call it as hilum within the viscera. So in the viscera we can call it as hilum, whatever the viscera you can take. So it is also will be the right lung. So there is a hilum within the right lung. So what are the structure has to be enter and exit from the lungs. So once you can feel with your fingers, then only you can differentiate. So because earlier what I had said, you cannot differentiate with your lobes and the fissure, you have to differentiate with the hilum. Okay. So what I am showing now, so this should be the artery over here at the center within the right lung. So this should be the pulmonary artery. So what I am showing here. So just above the artery and below the artery, you may see the bronchus. Okay. So this should be made up of cartilage. You can feel. Okay. This part will be the artery. So above the artery, you can see the bronchus. This should be the pulmonary vein and superior pulmonary vein and inferior pulmonary veins. So this should be the bronchus. Above the artery, we can call it as arterial bronchus. So this is a bronchus. Beneath the artery, we can call it as arterial bronchus. And there are pulmonary veins and pulmonary artery. So there are, if you can remember, I will tell you the mnemonic. This should be B, A, B, V. So B for arterial bronchus, A for artery, again B for arterial bronchus, V for the venous. So these are the pulmonary vein, 4 pulmonary veins, and one is a larger part should be the artery. Above the artery is arterial, below the artery is arterial bronchus. Okay, these are the principal bronchus will be entering only in the right lung. When you can compare to the left lung, there you can see only one cartilaginous opening. So that should be cartilaginous part for the principal bronchus. So here, once you can quick revise, within the hilum, it should be for the artery. Above the artery, we can call it as arterial. Below the artery, we can call it as arterial bronchus. So these are the pulmonary veins. So B, A, B, V are the structure has to be present within the right lung. Okay. So here you can differentiate whether it is a right and left. Along with that, you may see some impressions within the right lung of the mediastinal surface. So one you can see, this should be the pulmonary ligament. So this pulmonary ligament along with the hilum, it has to be separated by your visceral pleura, that you will know. So this should be the pulmonary ligament. I will tell you with your left lung. So this is the pulmonary ligament. It has to be attached to the cardiac along with the esophagus. So this is the pulmonary ligament. And over here you may see the hilum. So just you can see medial to the hilum. So this part, this is the impression for your heart. Heart has to be lies over here. So this is the impression for right atrium of the heart. So right lung for the right atrium of the heart, left atrium comes posteriorly and anteriorly it will be goes with left ventricle and right ventricle for your left lung. Over here, so because heart has to be present like this, then you can compare. So majority of the right atrium has to be located within the lung. So this should be right atrium. If it is right atrium has to be present over here, you can see the impressions from here. So this impression for inferior vena cava. So here is the impression for superior vena cava. So when you can see the right atrium for the drainage. So left ventricle has to be systemic circulation starts, it has to be drained in your right atrium. So once right atrium has to be present within the right lung, there is inferior part of the body. You can see the venous drainage as inferior vena cava, and here you can see the superior vena cava. So from the superior part of the body, veins has to be drained to the superior vena cava, then it will goes to the right atrium. So from there it will goes to the pulmonary circulation, then you may know the circulation part. So here is for the right atrium of the heart, inferior vena cava, superior vena cava. So along above the hilum, you may see an arc-like structure, arc-like impression over here. So this part for azygous vein. So there is an arch of azygous vein mainly in the right lung. So this has to be drained into the superior vena cava, then superior vena cava drains into the right lung. Okay. So this should be superior vena cava. This is for arch of the azygous, inferior vena cava, right atrium of the heart with fibrous pericardium has to be covered over here. So just medial to your hilum of the right lung, here you may see the right phrenic nerve along with pericardiophrenix vessels, and over here you may see the right vagus nerve. So this should be for the right vagus nerve. So this impression for the right phrenic nerve along with right pericardiophrenix vessels. And over here, just lateral to your superior vena cava, here you may see the tracheal impression and esophageal impressions. Okay, and right vagus nerve. Right vagus, hilum, right phrenic and pericardiophrenix vessels, right atrium of the heart, inferior vena cava, superior vena cava, arch of the azygous, then it will be drained into the superior vena cava. Above that you may see the trachea, and the quite you may see the esophageal markings also. Okay, that should be in mediastinal surface. So coming over here, within the apex you may see the first rib impression, mainly with the inner rib of the first rib, inner surface of the inner border of the first rib. Above that we can call it as apex. So this has to be surrounded with suprapleural membrane along with endothoracic fascia. So this will form a cap like this. It will goes to the cervical part or the root of the cervical cavity. So this should be for the apex of the lung. This is for suprapleural membrane along with endothoracic fascia. Suprapleural membrane, you know, that has to be made up of with scalenus minimus along with endothoracic fascia that has to be covered over here. So if there is any infection, it will spread with the cervical pleura, then it should be infected. So coming over here within the posterior border, what I had said. So this posterior border will be the round, and this posterior border will be divided into medially and laterally. So medial will be the mediastinal, posterior will be the vertebral surface. So this should be the rounded body. When you can see over here, you may see the ribs marking over here. So over here, it has to be articulate with the ribs, articulate with your vertebrae. So here you can see the costovertebral joint. So there are the impressions for costovertebral joint. So this will be almost till T10, it has to be impressed posteriorly with lateral to the posterior border for the vertebrocostal joint or costovertebral joint. So along with that, you may see very small bulby impressions over here. These are called for the sympathetic chains. Sympathetic chain over here along with posterior intercostal vein and superior intercostal artery, and the vein has to be impressed over here. So these are for superior intercostal artery and the vein, posterior intercostal vein, and over here you may see the costovertebral joint with vertebral impressions. So this rounded will be the posterior border. It should be divided into vertebral and the mediastinal surface. Mediastinal surface, you may see the azygous vein, it will form an arc. Along with, you may see the trachea and the esophagus posteriorly, and right vagus nerve along with vertebral body impressions. So this is posterior border along with vertebral surface and mediastinal surface. So coming to the last part, so this part will be the inferior surface or base of the lung. So this base of the lung has to be impressed when you can see from the right side. So this is the anatomical position. So here when you can see this part, it should be a concave part. So this part for mainly the liver has to be present within or below this. So below this you may see the diaphragm, that should be dome face shaped, and it is musculotendinous part, and beneath that you may see the major impression through the right lobe of the liver. So here you may see the right lobe of the liver, it had to be impressed. So that's what it should be, concave cavity in the inferior surface or the base of the lung. Okay, so just we can quick revise. So this should be the anatomical position of the right lung. So this is anterior border, it is very sharp, and it should be divided into mediastinal surface medially, laterally will be the anterolateral surface or costal surface. So this is apex will be divided by your first rib, mainly the inner part. Above that we can call it as triangular part should be the apex. It has to be covered by suprapleural membrane along with endothoracic fascia, and this should be the sharp border as anterior border. That should be continuation with inferior border. Inferior border divides into costal surface along with the inferior surface or the base, and posterior border it should be rounded. So this posterior border will be round, and it should be divided medially into mediastinal surface, laterally into vertebral surface, because here you can see the costovertebral joint. And coming to most important, hilum along with the mediastinal surface. So within the hilum you can see the fourth structure, artery. Above the artery is eparterial bronchus, below the artery is hypoarterial bronchus, pulmonary veins, and markings mainly from your azygous vein. It will form an arc over here, arc of azygous. It should be drained into superior vena cava, drain into right atrium. From inferior part, it should be the inferior vena cava. And here you may see the right phrenic nerve along with pericardiophrenec vessels, and here you can see the right vagus nerve along with upper part. You may see the trachea and esophageal impressions. So I think you may understood about right lung. So you understood right lung. Next we can go to the next video of your left lung. Thank you.